Greetings, everyone, and welcome to today's session. We're going to be starting the gastrointestinal system course, and today we're going to be covering the anatomy of the stomach. I'm Dr. Sally, and hopefully, I'm going to take you through all the important things that you need to know about the anatomy of the stomach today. Okay, so let's go ahead and get started. Before we get into the actual main topic of today's session, I just want to go over the points that we're going to be covering. So we're going to be looking at the location and general features of the stomach. We're going to look at the stomach structure and basically how it's divided into certain parts and how its muscles are arranged and so forth. We're going to look at the important relations of the stomach, which organs and which structures come in close contact with it. And then we're going to just touch on the blood supply and venous return. Okay, so just a quick reminder, you guys, that when we're studying the abdomen, we generally divide it into regions. Okay, and one of the things that you need to know is that each region or each quadrant has a specific set of organs that are found there. And you know that there are two ways that we can divide the abdomen. You can either divide them into what we call abdominopelvic quadrants, which is basically where the abdomen is divided into four different regions. The other division is what we call abdominopelvic regions, and this is where the abdomen is divided into nine subdivisions. Okay, so what I'm gonna do with this lecture and with the next one as well, which is the anatomy of the duodenum, I'm going to specify the location of the organ in both divisions. So I'm gonna give you this the location of the organs in this division and the location of the organ in this. So you're gonna need to know both of them. Okay, so the stomach is a J-shaped expansion of the GIT. And as you know, it comes directly after the esophagus, which is just basically like a tube, and then the GIT expands to form the stomach. It's located in the upper left quadrant of the abdomen, so that's when you take it as being four subdivisions. If you take it as the nine abdominopelvic regions, the stomach is located between the epigastrium and the left hypochondrium. So part of it is going to be found in the left hypochondrium. The rest of it is going to be found in the epigastrium. Now, its position and size are variable. Okay, so even though we say that it's located in the upper left quadrant or wherever, its position can shift. Okay, it can also change in size, either be expanded or not. And this depends on whether it is full or whether it is empty. So basically, if you've just had a meal or if you're, fasting or so. It's also dependent on the position of the person, if he's lying down, standing up, whichever. And being an organ that is found under the diaphragm, the phases of respiration will also affect the position and size of the stomach. Now, what we're looking at here is a picture of the stomach in its normal anatomical location. So you can see how it's located underneath the diaphragm in the left region of the abdomen. And what they've done is they've moved the liver out of the way. So you can kind of guess here that the liver is one of the anterior relations of the stomach so that they can give you a clear view of its different parts. So the first part of the stomach is just basically this part here where the esophagus ends and then the stomach begins. So it's basically where the two organs meet, and this is called the cardia. So the part of the stomach where the esophagus kind of joins with it is called the cardium. Now, above the cardia and to the left of the gastroesophageal junction, you have an upwards expansion or an upwards extension of the stomach. And this is the part that's located right underneath the diaphragm. And this is called the fundus of the stomach. Okay. Now, the next two parts are this region here, which is kind of just passing down from the side of the esophagus. Okay, and you can see that it's kind of like a small curve. So this is what we call the lesser curvature of the stomach. And since we have a lesser curvature on the opposite side here, this is going to be a more larger curve. So we're going to call this the greater curvature. And you can think of the lesser and greater curvatures as basically um, the the lines or the points that mark the body of the stomach. Okay, so anything extending down from the fundus in between the lesser and greater curvatures, this is the body of the stomach. Okay, and then finally we've got the end of the stomach, okay, which as you notice extends from the body, but then it starts to kind of like become narrow. So the body is relatively wide and then it narrows down. Okay, and this is what we call the pylorus of the stomach. So the end of the stomach, which is narrower than the body, is called the pylorus. Okay, and just keep in mind that the stomach also has two surfaces. The one that we're looking at here is the anterior surface, and then on the other side you've got the posterior surface. Now, that to summarize the different parts of the stomach, but when we're looking at the structure, we're going to look at the internal features of the stomach. Okay, the first thing I want you to notice is that looking on the inside of the stomach here, you can notice how its inner surface or its inner lining is irregular. Okay, it's thrown into folds. Okay, and these folds are called rugae. Okay, now the idea behind them is that they increase the surface area in terms of the size of the stomach. Remember, you know, some of you can have like a really big meal one day, all right, because you're just feeling like extra hungry, and then the stomach's really gonna get filled up with stuff. So that means that its size needs to be able to expand depending on how much intake there is, and it needs to be able to stretch. So if the lining of the stomach was regular, whenever you had a meal and the size of the stomach changed, it would basically end up being ripped apart. So the idea is that these rugae help with expansion of the stomach and allow for more surface area. Okay? Now, normally the muscles of the GIT structures or the GIT organs, the muscles of the wall, I mean, are usually two layers. You've got the longitudinal and you've got the circular layer. Now, with the stomach, there's actually an extra layer, okay, which is this innermost layer here, and you can see that it's kind of passing at an angle, okay, so we call these the oblique muscles. So the stomach differs from the other parts of the GIT by having three layers of muscles as opposed to the normal two. So the inner wall, the mucosa and the submucosa of the stomach, is thrown into folds which are called rugae. You can also refer to them as the gastric folds, and like I mentioned, they serve to increase the surface area. The muscularis propria of the stomach is arranged as three layers, like I said, as opposed to the usual two. And these are an inner oblique layer, and the importance of the oblique layer is that it assists or is important for the formation of the rugae. So the inner oblique layer actually allows the formation of the folds and allows them to stretch when needed. And then you've got the middle circular layer and you've got the outer longitudinal layer. Now, the stomach communicates with two organs. It communicates with the esophagus at its origin. So the beginning or the upper part of the stomach communicates with the esophagus. And then the end of the stomach communicates with the duodenum. Now, remember, or the point that we brought this up for is because since it communicates with two organs, then that means that at any given time, these contents or the contents of the stomach can pass in between these two organs depending on the pressure. So if you squeeze the stomach too much, its contents can either pass to the duodenum or they can pass to the esophagus. And we know that, obviously the food needs to stay in the stomach for a while in order to allow digestion to happen. So that means that we don't want free communication between these three organs. So, what happens is there is an anatomical sphincter, so an actual physical sphincter, that is found between the stomach and the duodenum. This is called the pyloric sphincter. So, it's basically a muscle that is located between the stomach and the duodenum, and then depending on whether it is closed or open, the contents of the stomach can either pass into the duodenum or stay within the stomach. However, no such sphincter exists between the stomach and the esophagus. So that means that there is no physical barrier or no muscular layer that opens and closes between the stomach and the esophagus. So, for you guys to do as homework, I want you to go find out how the reflux of gastric contents into the esophagus is prevented. So remember I said the three organs communicate. You've got the stomach and the esophagus, sorry, and the stomach and the duodenum, okay? Which means that the contents can pass between them at any given time. We've seen how there's an anatomical sphincter between the duodenum and the stomach, so that means that it controls the passage of gastric contents into the duodenum, but there's no sphincter between the esophagus and the stomach, no physical sphincter at least. Okay, so I want you guys to go find out and read about what stops reflux or the contents of the stomach going back into the esophagus. Okay, we're just going to quickly look at the relations of the stomach now, okay? I already mentioned a little earlier that the liver or part of the liver passes in front of the stomach. And what you're looking at here is a picture where the omentum has been cut and then the stomach has been reflected, okay? And the first thing that I want you guys to notice is how there's this, let's just call it a wire, okay, that's been placed behind where the stomach should be. So the stomach should be in this region here, and then there's a wire that's been placed behind it. Now, this wire represents a space that is found behind the stomach, and this is called the lesser sac. So basically, the stomach has a space behind it where you can kind of just like insert your fingers or insert a wire, and this is called the lesser sac. Now, once we remove or reflect the stomach, you're going to find a number of organs that are found behind it. This region is called the stomach bed, okay? And you can kind of identify some of the organs. So you've got, for example, the pancreas passing across here. At the back here, you've got the upper end of the kidney and the suprarenal glands. You've also got the transverse colon and mesocolon. Okay, so these are structures or organs that are found behind the stomach, within the stomach bed. So anteriorly, the stomach is related to obviously the abdominal wall, so the muscles of the abdomen. It's also related to the left costal margin. As we saw, it's found in the left hypochondrium with the lower part of the rib cage covering it. It's also related to the diaphragm, and we saw earlier how the left lobe of the liver just kind of passes in front of the stomach. Posteriorly, like I said, we have the space which is called the lesser sac, and it separates the stomach from structures like the pancreas, the transverse mesocolon, the left kidney, and the spleen. And superiorly or above the stomach, we have the left dome of the diaphragm. Okay, now we're going to look at the blood supply of the stomach. Okay, and we're just going to go through this in picture form. Okay, so the thing to keep in mind is that each part of the stomach needs to be supplied by its own specific set of arteries. All right, and what we're looking at here, first of all, you've got the abdominal aorta passing at the back here. Okay, now an artery comes out of the anterior aspect of the abdominal aorta, and this is called the celiac trunk. Okay, and remember, you guys, whenever we say or refer to an artery as a trunk, then that means that it's going to divide into other branches that supply the organs, okay? So the celiac trunk is an artery that comes out of the anterior aspect of the aorta, and then what it does is that it divides into 3 arteries, okay? Which are this one here, this second one here, and this third one here, okay? Now, the first artery that comes out towards this side, okay, this is called the left gastric artery, okay? And you can see that the left gastric artery is supplying part, sorry, my bad, is supplying part of the lesser curvature, and it's also supplying branches up here to the esophagus, okay? So basically the lesser curvature, or part of the lesser curvature of the stomach, is supplied by the left gastric artery, which comes directly from the celiac trunk, okay? Now the second branch that comes out of the celiac trunk is this long one here, and if we follow it, you'll see that it's passing behind the stomach and eventually reaching the spleen, okay? So we're going to call this one the splenic artery, since it passes to supply the spleen. Now, what the splenic artery does, okay, is that it gives off a set of arteries here that are passing to supply the fundus of the stomach, and these are called the short gastric arteries. Okay, so the short gastric arteries from the splenic artery supply the fundus, and at the same time it gives off another artery here which supplies part of the greater curvature, which is called the left gastroepiploic artery. Okay, so far what we've done is we've supplied part of the lesser curvature, we've supplied the fundus and part of the greater curvature. The lesser curvature was supplied by the left gastric, the fundus was supplied by the short gastric, which came from the splenic, as well as the gastroepiploic for the greater curvature, which also came from the splenic. Okay? Now, the third branch, or the third artery that comes out from the celiac trunk is called the hepatic artery here. Okay? Now you see what the hepatic artery does is that it gives off a branch here, okay? And this branch is going to end up supplying the rest of the lesser curvature, okay? And this artery is called the right gastric artery, okay? So just basically remember that the gastric arteries supply the lesser curvature. You've got the left gastric from the celiac trunk, and you've got the right gastric from the hepatic artery, okay? Sorry. Now, another branch that comes out of the hepatic artery is called the gastroduodenal artery, which is this artery here, and you can see that it's kind of passing down behind the pylorus, okay? Now, you can kind of guess from the name of that artery, gastroduodenal, it means that it's going to end up supplying the stomach as well as the duodenum, okay? And what the gastroduodenal artery does, if we follow it down here, okay, is that it gives off an artery that ends up supplying the rest of the greater curvature, okay, and this is called the right gastroepiploic artery, okay? So in summary, you've got gastric arteries supplying the region of the lesser curvature, you've got gastroepiploic arteries supplying the region of the greater curvature, and you've got the short gastric arteries supplying the region of the fundus. Okay, so just remember the names of those different arteries, okay, and the region that each one supplies, and the original artery where they branched off from. Okay, so that wraps up the anatomy of the stomach lecture. I hope that session was useful for you. And as usual, I'm available for questions if you have any. Keep in mind that the reading task is a requirement, so please make sure you do it because we're going to be having that as a discussion forum for you guys to just kind of practice with that topic, okay? So I'm going to wrap this up and I'll see you guys in the next lecture.